Hi, I'm Aubrey Going, and today we're going to talk about sciatic nerve pain. The sciatic nerve is a fairly complicated nerve in that it has multiple nerve branches that come out of the spine and then unite to form one solid nerve trunk. So they exit in the lower back, in the lumbar spine, and also in the fused vertebrae of the sacrum. These travel out through the pelvis and then down through the back of the pelvis, underneath the buttock, through the area of the hamstrings, where the nerve then divides at the back of the knee into the tibial and common peroneal nerves. So there can be two primary causes of sciatic nerve pain. One is disc pathology. So where the nerves are exiting the spine, they can become trapped, and this is where the nerve is pressed against bone. This is usually down to disc pathology and can be diagnosed by using an MRI. The second is nerve entrapment. Sounds similar, but it means that the nerve is being compressed by soft tissue. So this is after the nerve has exited the spine, multiple nerve roots come together to form a thick cord called the sciatic nerve, which is a lot bigger than most nerves. It's about the size of your little finger. And this large branch of nerve tissue passes through the pelvis, and here tight muscles can compress it. So as we said, the sciatic nerve is quite a complicated nerve made up of multiple nerve branches coming out from the spine. So we have lumbar branches and we have sacral branches, and they unite to form this thick cord known as the sciatic nerve. So the sciatic nerve comes out at the front of the pelvis, comes through this opening in the back of the pelvis and travels down the back of the thigh underneath the hamstrings. Now the hamstrings have been removed here so that we can see it, as have the muscles in the back of the pelvis. We've taken away the top layer, but we can see smaller muscles underneath. This one is generally quite well known, certainly by sciatic sufferers. It's called piriformis. And sometimes people suffer from what's called piriformis syndrome. So this muscle can put pressure on the sciatic nerve and cause sciatic type symptoms. Another muscle that we'll find in this area of the pelvis is a rotator. It turns the femur. It's called quadratus femoris. It turns the foot and the leg out. And when it does that, the space between the thigh bone and the pelvis reduces. And so the nerve can become compressed or, again, entrapped as it passes through this area and as a result cause symptoms down the leg. As a general rule, the greater the pressure on the nerve, the further the symptoms travel. So let's take a look at some rehab that we can do, some exercises to help get the rotation out of this femur and take some pressure off the sciatic nerve if the pain is coming from these deep hip rotators.
In a treatment session, myofascial techniques can be used to derotate the femur and address fascial adhesion in the thigh and in the pelvis. Trigger points in piriformis can be released to reduce contracture and also nerve sensitivity. And then therapist-assisted stretches can help restore range of motion and normal muscle resting length. This can be repeated at different angles to address each of the deep hip rotators in the back of the hip, reducing pressure on the sciatic nerve. The client can then maintain the effects of treatment at home with targeted stretching exercises to remain pain-free.
Hope you enjoyed this short video and found it helpful. If there's subjects you'd like to see us cover in future videos, particular injuries or explanations of anatomical structures, please do get in touch with us either by leaving a note in the comments or you can email us at info@hcd.ie. You can also find information on our training seminars as well as our resource materials such as DVDs and books on our website. It's hcd.ie. If you'd like us to travel to you to provide a seminar in your area, please do get in touch. Thanks for watching.